We're about to look at COVID-19 updates. Not really the best, but it's a reality we're living with, and we have to keep ourselves informed just to be safe.
COVID-19 Diaries.
COVID-19 Diaries.
COVID-19 Diary.
Well, the total figure is 156,784,352. That's the number of people globally who have contracted the COVID-19 virus. Now we have 134,181,346 people globally who have recovered from the COVID-19. Unfortunately, the world has lost 3,272,175 lives to the COVID-19. Our condolences going out to everybody out there who's lost a family member, a loved one, anybody to this virus. Bringing it down, let's look at the figures for Africa.
COVID-19 Africa.
COVID-19 Africa.
Daily updates.
In Africa, we have 4,649,471 people who have contracted the COVID-19 virus. And we have 4,182,668 people who have recovered from the COVID-19 virus here in Africa. Unfortunately, the continent has lost 123,944 lives to the COVID-19 virus. The country with the highest recorded cases of COVID-19 is still South Africa, and they have 1,590,370 cases of the COVID-19. The country that, look, I don't know what you guys are doing there. I don't know how you guys are doing this, but Charlie, kudos. If I had a hats off, big up to you guys, because you guys have been doing well. For months on end, you've just kept it at 10. They have the least recorded cases of COVID-19. We're talking about Western Sahara. They've had 10 cases for months, more than 6 months. They literally have just stopped the spread in its track. And I just want to believe that the neighboring countries can look at what they're doing and emulate it so that it could actually reflect in the figures. But kudos to you guys in Western Sahara. Unfortunately, the country with the most recorded fatalities is South Africa, and they have lost 54,620 lives to the COVID-19. Condolences going to the whole nation of South Africa, Charlie. We stand with you guys in solidarity. Let's keep doing everything we can. Observe all the safety precautions, the social distancing, anything, and the inventions you guys are bringing. It's amazing. Let's just keep the hope up and keep this. We'll definitely get over this, and we'll get past this one day. We're looking at a COVID-19 related story. This is actually coming, and it's coming from Chad, but interestingly, it's actually related to Côte d'Ivoire. So it says the first dose of the COVID-19 vaccine required before 12 May in Côte d'Ivoire. The first dose is being required before 12 May in Côte d'Ivoire. Now, the Office of the Hajj in Côte d'Ivoire, which reassures that the 2021 edition of the pilgrimage to Mecca will indeed take place, has stated that the first dose of the COVID-19 vaccine is mandatory before 12 May 2021 in a note. The first dose of the COVID-19 vaccine is mandatory before 12 May 2021, he said in a briefing note from the Hajj office in Côte d'Ivoire. Now, they report that all programs already registered are concerned. So that this basically covers for our Muslim brothers and sisters out there, those who are observing the fast, those who are actually looking to go to Mecca. It's not cancelled, it's coming on. But before you actually can go, you have to make sure that you have at least the first dose of the COVID-19 vaccine. And this must be done no later by 12 May. You should have it before. For those who have already gone ahead to register too, please, it also applies to you. So just make sure you go get the first jab, and then you bring your papers, your certificate to actually show your card to show that, yes, you've got it, and this was the day that you got it. Now, looking at Côte d'Ivoire, on Wednesday, they had 46,231 confirmed cases, including 45,733 people that had been cured or recovered. And they've recorded 291 deaths and 207 active cases. But then on 4th May, 14,191 people had been vaccinated against the COVID-19 vaccine. The virus, sorry. Well, that's all we have for you coming from the camp of COVID-19. Let's do all to stay safe. Our president said it, and sometimes we underestimate it, but look, we can always rebuild the economies. If you have life, you can still make money. But if you die, you can't bring the people back to life for them to make money.